Good morning, everybody. Welcome to the Air Dental Academy. As we bring you all the new videos on the different topics and lectures. So today, as you see, we have this lecture on the suturing models. Okay. As you see here, we have a suturing mandible maxilla jaw set, in which I will give you the demo. This I have a silk non-absorbable suture. Okay. This I would like to show you. This is the vicryl absorbable suture. Now, what is the difference between this and this? This is the absorbable suture. The suture is given to the patient. It absorbs within 15 and 20 days by the hydrolytic enzymes of your gingiva. So this is a self-absorbable suture, whereas this is a non-absorbable. Then and what, it has to be removed by the dentist only in the patient gingiva. Okay. Then I would like to show you, these are your needles when you will buy for the clinic from the market. These are called the stainless steel needle. Okay. You can directly buy from the market on the online website. And what is this needle? This is called the 3x8 reverse cutting needle. Always remember, size is 3x8 reverse cutting. What are the parts of it? This part is called the needle point. This part is called the needle body. And this part is called the swag area. If you see the thread is passing, SWAG, swag area. Whenever you want to hold the needle, always hold needle 1/4 from the swag area. This is the position. Always remember, any surgical type, any surgical work you want to do, hold it 1/4 from the swag area, or you can say junction between the swag area and the needle body. Okay. Now I will give you the demo of the soothing techniques. There are a lot of soothing techniques, but mostly they are broadly classified into 3 types. The basic is called the single interrupt technique, if you know it, because it is worked mostly in every such technique. You go in implant, you do in crown landing, you do in episectomy, you can work in single interrupt technique. So what is the technique? If I like to show you, if we want to suture on this 3rd quadrant area or the 4th quadrant area, if you see, this is your buccal flap area, this is the lingual flap. So what your book says, these papilla, okay, every tooth you have a different papilla, a triangle shape. So the triangle shape papilla, if you see here, it's like this. Okay, so always take the bite from this base of this papilla. Okay, imagine this is the papilla. So you take a bite from 5 mm from the tip down. Okay, the base of the imaginary papilla. When you insert it, the needle should go straight. When the half of the needle is advanced, take it on the upside. Hold it from the finger, index finger from one side, and try to take it out from the inside area. This is the buccal bite of the suture has been completed. Take out the suture and leave a very small amount of thread, around 5 mm, 6 mm on the buccal side, so as to save up your suture. Now the buccal is complete. Same as the side, you will take the lingual side, you will take the lingual flap and you insert it again in the same direction. Okay, and when you pull it, half of the heft is gone, you take it out in a same upward direction. Try to push it from the lingual flap and you can take it out from the upwards lingual area. Okay, so this, now the bites buccal lingual are complete. Suturing is yet not complete. Now what is left? Please see it very carefully. This is the main technique, the knot. So the needle is kept on the left hand area, needle holder in right hand area. You have to wrap it round. 1 wrap clockwise, 2 wrap clockwise. Always remember, the wrap is always clockwise in the first turn. Take your needle holder and open it from the handle, and take the smaller one and just try to pull it. Your 1 knot has been totally completed. If you think, now it depends on the operator, you think the gingiva is very thin, you can cut it this part. If you think the gingiva is thick and the suture can get open, you can give 1 more anti-clockwise. And again the same technique, open needle holder and give it a knot here, tightly complete. Okay, whenever you want to cut the suture, always remember, take your suture cutting scissor, hold the 2 sutures together and cut it from the tip at least 4 mm. Your suturing is totally complete. So this technique, interrupted technique, you can practice in literally any surgery, any case, implant, episectomy, crown landing, wherever you think that flap is not getting closed, bleeding is profusely bleeding there, you can do with your interrupted. Okay, now I like to give you a second technique, that is your figure of 8, the very famous suturing technique you must have heard. When you do extraction of the NE6, NE7, NE8 upper lower, you do figure of 8. So what is the figure of 8? Now if you clearly see, this is the combination of two interrupted, okay? Two interrupted figure of 8 techniques. Whatever you do start, same as you start in the mesobuccal area interrupted, you take the buccal bite, and the difference is here that you take the lingual bite together with this technique, okay? You take a lingual bite together with this technique, okay? See, I have taken the mesobuccal and the mesolingual here together, okay? And I'll just take it out in a single blow, and see, we have taken the mesobuccal lingual together. Now, as you know, the molar socket is big, so we'll try to leave some space, and then I will take the distobuccal and distolingual together. See, same as you do interrupted. Only difference is that you have to take the bites together as if you can plan it, okay? So I'll take the distobuccal and distolingual bite together. Same insertion, same buccolingual insertion. Take it from the lingual side, and you take it out. And if you see, we have got a half figure of 8. And now the terms come the knot. So same knot technique, one rotation clockwise, two rotation clockwise, you take the smaller one and you just put a knot. This is your complete and good figure of 8. Again, the knot comes if you want to have one more suture, you can give a clockwise and you can give one more knot. Okay, so this completes your figure of 8 technique. Okay, simply want to cut it. Again, you want to cut it, hold the two sutures together and literally cut it from the tip along with the area of at least more than 4 mm. Your figure suture is complete. Okay, last technique I want to give you demo, which is used very rarest, but still some of the part has been used in some surgeries. That is called the continuous technique. Okay, so what is that continuous technique? You must have heard terms of alveoloplasty, or if you have done some extractions around 8 and extraction, 5 extractions in a one patient single time. So you want your flap to be closed multiple times. So that area you do a continuous technique, also called the mattress technique. So what is this technique? If you clearly see, give a good buccolingual interrupted as you give, okay, together as you give in figure of 8, okay, and you take it from the buccal side, take it from the lingual side, okay, and just what is the difference in between here? You give it a knot here. Only one difference in between figure of 8 and continuous, that you give a knot here. One knot, two clockwise, and you just pull it out. Okay, so you have a knot here. And now what you do, you just simply start taking your multiple bites as you want to close the flaps. I would like to show you. See, now there is no knot, okay? Only I will take the buccal and the lingual bite. So one, okay. Again I'll take it out, but here there will be no knot, okay? As you see, the flap will start getting closing at approximate all the areas, okay? Second, okay, so just take the serials knot all along the area. Third, I will take again the buccolingual bite. As you feel comfortable that all the suturing is completed and all your flap is totally completed, you can just do this suturing knots, okay? If you convince now, see my flap has been closed and I want this much flap, okay, I'll give you one more knot. See, you will see, I'll give you one more knot and you will see from this area. Just you have to take a knot in the beginning and you have to cut it in the end, okay? In between, just take the single knots. Now example, if you feel comfortable here that my flap is totally being closed, same knot you have to give, one clock rotation, two clock rotations, take the smaller one and you just pull it. See, a complete flap has been closed. This is called your continuous or sometimes the mattress technique. So this is practice where you practice the alveoloplasty, where you practice multiple extractions, you want the flap to be closed, you can practice the continuous technique. Okay, so basically these 3 techniques which I wanted to show you, give you a demo of all these 2 techniques. Here at the Head Dental Academy, we practice these all 2 techniques, all the procedures directly on the patients under direct supervision of the NDEB faculty. Do with our YouTube channel for all the continuous education series and the videos. Thank you.
Now you can have